Today we're diving into a super important topic that you definitely don't want to miss. We're talking about the 12 strange early signs that your liver might be in trouble. Your liver is like the unsung hero of your body, working tirelessly behind the scenes to detoxify your blood, produce bile, and help with digestion. But sometimes our livers can cry out for help, and we might not even realize it. So in this video, we're going to explore 12 strange early signs that your liver might be sending you an SOS. Okay, first up on our list of strange liver signs is jaundice. Jaundice happens when there's too much bilirubin in your blood. Bilirubin is a yellow pigment that's produced when red blood cells break down. Normally your liver filters out bilirubin, but if your liver is damaged, bilirubin can build up in your blood and cause your skin and the whites of your eyes to turn yellow. It can vary, but even a slight yellowish tinge to your skin or eyes is worth getting checked out by a doctor. Jaundice can be a sign of a bunch of different things, from something as simple as a blocked bile duct to something more serious like liver disease. So, if you notice any yellowing, don't panic, but definitely don't ignore it either. Next up, we're talking about abdominal pain and swelling, specifically in the upper right abdomen. Pain related to your liver is often described as a dull, aching pain just below your ribs on the right side. You might also experience some swelling in that area. This happens because your liver is located in the upper right part of your abdomen, and when it's inflamed or enlarged, it can press on surrounding organs and tissues, causing discomfort. So, if you're experiencing persistent pain or swelling in your upper right abdomen, it's definitely worth getting it checked out by a doctor. Think of it like this. Imagine your liver is like a roommate who's decided to start lifting weights. Let's talk about chronic fatigue. We're talking about a persistent, overwhelming fatigue that just doesn't seem to go away, no matter how much sleep you get. If you're feeling constantly drained and exhausted, it could be a sign that your liver isn't functioning at its best. Your liver plays a crucial role in converting food into energy. When your liver is damaged, it can't do its job as efficiently, which can lead to a lack of energy and that feeling of constant fatigue. So if you find yourself constantly reaching for another cup of coffee or feeling like you could sleep for a week straight, it's worth considering your liver health. Of course, fatigue can be a symptom of a lot of different things, so it's important to talk to your doctor to rule out any other underlying conditions. Next up on our list of strange liver signs is nausea or vomiting. If you're experiencing frequent or persistent nausea or vomiting, especially if it's not accompanied by other common symptoms of a stomach bug like diarrhea, it could be a sign that your liver is struggling. Your liver plays a vital role in filtering toxins from your blood. When your liver is damaged, it can't remove these toxins as effectively, and they can build up in your system, leading to feelings of nausea and vomiting. So, if you're feeling constantly queasy or you're throwing up more often than usual, it's important to consult with your doctor to rule out any liver-related issues. It's like your body's way of trying to get rid of those harmful substances. Let's talk about loss of appetite. If you're experiencing a sudden and unexplained loss of appetite, especially if it lasts for several days or more, it could be a sign that something's up with your liver. A healthy appetite is actually a sign of a healthy body, and a sudden loss of appetite can be a warning sign that something's not right. When your liver is damaged, it can affect your digestion and metabolism, leading to a decrease in appetite. This is because your liver produces bile, which helps break down fats in your food. When your liver isn't producing enough bile, it can lead to digestive issues and make you feel less hungry. So if you're noticing a significant decrease in your appetite, don't just brush it off. It's important to talk to your doctor to rule out any underlying medical conditions, including liver problems. Okay, let's talk about pee. Specifically, we're talking about dark urine. If you're consistently noticing that your urine is dark brown or tea-colored, it could be a sign of liver trouble. When your liver is functioning properly, it helps remove bilirubin from your body through your urine. But when your liver is damaged, bilirubin can build up in your bloodstream and make its way into your urine, giving it that dark color. So, if you're noticing any unusual changes in your urine color, especially if it's dark brown or tea-colored, don't ignore it. It's important to talk to your doctor to get it checked out. We're going to keep talking about bodily fluids for a minute, but this time we're focusing on poop. Specifically, we're talking about pale or clay-colored stool. The color of your stool can actually tell you a lot about your health, especially when it comes to your liver. Normally, your stool gets its brown color from bile, which is produced by your liver and helps with digestion. But when your liver isn't functioning properly, it may not produce enough bile, or the bile flow may be blocked. This can result in pale, clay-colored stool. If your poop is looking unusually pale, it could be a sign that your liver is waving a little red flag trying to get your attention. So if you're noticing this change, don't be afraid to talk to your doctor about it. It's important to talk to your doctor to rule out any underlying medical conditions, including liver problems. Let's talk about itchy skin. If you're dealing with persistent, unexplained itching that just won't quit, it could be a sign of liver problems. When your liver is damaged, it can't filter toxins from your blood as effectively. These toxins can then build up in your body and irritate your skin, leading to that unbearable itching sensation. So, if you're finding yourself scratching more than usual and you can't seem to find relief, it's worth considering your liver health. Itchy skin can be caused by a number of things, from allergies to dry skin. But if the itching is persistent and unexplained, it's always best to talk to your doctor to rule out any underlying medical conditions. Let's talk about swollen legs and ankles. If you're noticing persistent swelling in your legs, ankles, or even your feet, it could be a sign of a more serious underlying condition, including liver problems. When your liver isn't functioning properly, it can lead to a condition called edema, which is basically just a fancy word for fluid retention. Edema happens when your body retains excess fluid, and this fluid often accumulates in your lower extremities, like your legs and ankles, because of gravity. So, if you're noticing persistent swelling in your legs and ankles, don't just ignore it. It's important to talk to your doctor to figure out what's causing the swelling and get the appropriate treatment. Think of it like this: your circulatory system is like a network of pipes, and your liver is like a pump that helps keep the fluid moving through those pipes. Let's talk about easy bruising or bleeding. If you're noticing that you're bruising or bleeding more easily than usual, it could be a sign that your liver isn't producing enough clotting factors. Clotting factors are proteins that are essential for blood clotting, which is your body's natural way of stopping bleeding. Your liver plays a crucial role in producing these clotting factors, so when your liver is damaged, it may not produce enough of them, which can lead to easy bruising, bleeding gums, or nosebleeds. So if you're noticing that you're bruising or bleeding more easily than usual, don't just dismiss it. It's important to talk to your doctor to rule out any underlying medical conditions, including liver problems. Let's talk about something that might seem a little surprising: confusion or cognitive issues. Your liver plays a crucial role in removing toxins from your blood. When your liver isn't functioning properly, those toxins can build up and affect your brain function. This can lead to a condition called hepatic encephalopathy, which can cause a range of cognitive problems, including confusion, difficulty concentrating, memory problems, mood swings, and sleep disturbances. So if you're noticing any unusual changes in your cognitive function, don't just brush it off as stress or getting older. Finally, let's talk about spider angiomas. These are small, spider-like blood vessels that can appear on your skin, usually on your face, neck, chest, or arms. They're called spider angiomas because they kind of look like tiny spiders, with a central red dot and thin blood vessels radiating outwards. When your liver isn't functioning properly, it can lead to changes in your hormone levels, which can cause these spider veins to develop. So, if you're noticing these spider-like blood vessels on your skin, don't panic, but don't ignore them either. It's worth talking to your doctor to rule out any underlying medical conditions, including liver problems. Think of it like this: your body is constantly sending out signals, trying to tell you what it needs. Thanks for watching. We've covered a lot of ground today, from jaundice to spider angiomas. Remember, your liver is an amazing organ that works tirelessly to keep you healthy. So if you're experiencing any of these symptoms, don't ignore them. Talk to your doctor, get checked out, and take care of your liver. And as always, thanks for being awesome.